This is Tom Bernanke, and today I'm going over leg blood clots. There's two types of things that I think about when it comes to leg blood clots. There's an actual blood clot that develops and blocks it almost immediately called a deep vein thrombosis. And then there's the ones that gradually narrow and narrow and narrow and narrow, and that's called arterial sclerosis. So I'm gonna go over a little bit of both, but I'm gonna focus more on arterial sclerosis, some of the stuff that you can do. But I'm gonna give a word of caution. These can be emergencies. These are probably the most serious things we deal with the foot and ankle. It's not just pain, but a deep vein thrombosis can shoot up into your lungs and cause a pulmonary embolism. And arterial sclerosis, that's the narrowing, what that can do is essentially clot your arteries so that you develop gangrene and your toe can go black and dark. And this is unfortunately a reason we need to amputate people's toes, feet, or even legs. So this is a very serious topic and probably the most serious thing that we deal with as foot and ankle surgeons. So the disclaimer is these videos can always contain inaccuracies, even though we do our best. So if you have a concern of a blood clot, always see your doctor. Don't mess around and try and self-diagnose with a video, because this clot can break free in your vein and shoot up to your heart and lungs and plug them and cause serious problems, even death. And also blood vessels or arteries, in this case, can build up fat in the smooth muscle, and this could plug the blood flow, causing gangrene down to your toes. So these are serious. Don't rely on this guy right here. Only go get checked out. The narrowing takes place in your arteries. That delivers blood flow to your toes. And the clots, which is your deep vein thrombosis, happens on the way back up to the heart. So we're gonna get started on how to diagnose it, what the symptoms are, which doctors to see, what to do about it, how to prevent it, the home remedies, the medical treatments, the medications. But first, I could use a favor from you. Guys, thank you so much for watching this video. We appreciate your likes, your subscribes, your comment. We really love hearing if this stuff helps. It really makes a big difference for us, so thank you. If a clot is suspected, a venous duplex Doppler may be necessary to check where the blockage is. And these are performed in the emergency room. So if a patient comes in here with this type of problem, right away, we don't even mess around. Go get checked out. If you think you're worried, we consider these very serious problems because there are a lot of blood vessels in the legs, and sometimes the symptoms are clear, sometimes they're not that clear. And you can see there's a lot of arteries, a lot of veins in the legs, the calf muscles, especially now with medications. People are beginning to realize how serious some of these risks are and how much you don't want to mess around if you're concerned. So first I'm going to start off with the arterial supply, because this is something that sneaks up on people, especially older people. This is the commercials you see where basically plaque develops in the smooth muscle of your arteries, just like in your heart, and it narrows and narrows and narrows. And a blood vessel that looks like this squeezes down to basically nothing, and the blood flow cannot get through. This is usually associated with old age. And what I mean by that is people are like, hey, I can't walk as much as I used to, I'm tired, and they don't think anything is wrong, but one day they wake up and their legs are in severe crippling pain. So this starts with some numbness, burning, aching. When you're walking longer distances, this is called claudication. So your feet start spasming and they're weak and you need to take a little break, then they feel better. When it gets really severe, when you're sitting on the couch, when you lift your feet up in the air, it starts to throb and ache. But when you lower them again, that's when it starts to feel better. That's when it gets most severe. That's called claudication rest pain. And that's when you really want to see your podiatrist. And that's the disclaimer I always give is come see a podiatrist for foot and ankle problems. We work with vascular specialists, cardiologists, and vascular surgeons in our office, and we can do tests called minimally invasive tests. So these are things where blood pressure cuffs essentially go on your thigh, your calf muscle, your foot, and your toe. And with a venous Doppler, it measures how much blood is flowing through those blood vessels. If there are criteria that the blood flow is too poor, so for example, if the blood pressure in your arm is much higher than the ones in one leg or the other leg, then it makes sense to go to see a cardiologist and a vascular surgeon. When I think about the heart, it has to work hard, and everybody has a heart with strong muscles. But when you become very large since you were a little kid, the heart necessarily doesn't grow proportionately. So it has to work harder and harder and harder, and it needs more muscles. That's when heart attacks can happen. That's when blood vessels can narrow. And the problem is, not only is your body a lot bigger, so it has to supply more blood flow, but the blood vessels get narrowed. So this is where a cardiologist or a vascular specialist, like a vascular surgeon, can come in. They could open up those blood vessels to help the heart a little bit, get the blood flow down better. So you want a strong heart and you want smooth open vessels by a specialist. They can do something called an angiogram, and an angiogram essentially is going down your blood vessel under imaging and seeing where there's a blockage. Then the vascular specialist can do one of two things. They can either balloon it open and drop a stent in there, and that stent holds that vessel open. Or they can do, in more severe circumstances, if it's blocked for a very long period of time, a bypass, which is a road around. So sometimes that's a fake vessel or using a vein to go around. So the bypass is a little bit more invasive. That's more of a surgery, whereas a placement of a stent is something that has a little bit of a quicker recovery time that can be done in an imaging suite. So the risk factors for arterial problems, that's the narrowing, is smoking. So if you're smoking, stop smoking. That's the biggest thing we can tell you. This is no secret at this point. Number 2 is diabetes and being overweight. If you're eating sugar, if you're a diabetic, go see your primary care doctor, get on the right medications, get that swelling down, get that feeling a whole lot better. If you're overweight, so if you're weighing a lot, clearly being healthier, having more muscle mass, less weight, makes you healthier. If you can exercise more, if you can ride a bike, if you can swim, that will help your blood flow quite a bit. If you have high blood pressure, get that blood pressure down. That could really help out. See your primary care doctor. Family history. If you have a family history of blood clots or heart problems, go get that checked out, get that taken care of as well. On the other hand, you have your venous supply. This is what returns blood flow to your heart. This is where you could develop a clot which blocks that vein. In itself, that's not dangerous because you have a lot of different ways that your veins can go and return the blood flow. What the danger with this venous blood clot is that this blood clot can break free and shoot up to your heart. And this can be a life-threatening emergency. This is called a pulmonary embolism. This can get stuck in your lung and plug up the lung, and you could, I think it's a 50% chance of dying, that's what I've always been taught, but nonetheless, it's very serious. If you have a deep vein thrombosis, what happens is it's usually one leg compared to the other. It's usually in the calf, it could be in the thigh or in the hamstring, but most of the time it's in the calf muscle. It's gonna be big, red. What the difference is compared to other causes of swelling is it's usually just one leg compared to the other. Theoretically, you could have 2 clots, one in each leg, but that's extremely rare. So if you squeeze your calf and it hurts and it's red and it's sore and it's swollen, that's going to cause a lot of problems in that leg. And then eventually it could shoot up. There's that risk factor. So what you want to do is go see your podiatrist or primary care doctor. If they think that it's a blood clot, they will all order something called a duplex Doppler. So what happens with the duplex Doppler is they will scan your vein. This is done at the hospital, and they will see, is there a blood clot there? So if it is an emergency and you're like, hey, this is 99% chance I have one, go to the emergency room. That's kind of the warning. And a venous Doppler can be performed. There's other tests like a D-dimer, some blood tests, but realistically, go get the venous Doppler. That's kind of the standard treatment. Diagnosis, I should say, not treatment for a vein problem. And what can happen is then you're referred to a blood flow specialist. So you're put on a couple different medications in this case. If it's very severe, you could be admitted into the hospital for something called a thrombolytic, which is an IV medication, which essentially breaks up the clot. But these can be dangerous and you have to be in the hospital. What generally happens is you're put on a blood thinner for 3 months or 6 months, depending on what the criteria are on your area. And again, as a podiatrist, I'm not the one prescribing these, but we diagnose these quite a bit and send them to our vascular surgery and cardiology colleagues because these are serious blood vessel disorders. So how do you prevent vein problems? So this is when people sit for long periods of time. So when you're on long car trips, long plane rides, what you want to do is you want to use your feet. Bend your feet up and down 10 times, lift your legs, do some toe rises. What I'm a big fan of is compression socks. So the tricky part is you don't need medical grade compression socks. So in my opinion, insurance doesn't cover stuff well anyway. Like even if you think they're covered, they're not really covered. Buy some ones online, they're dirt cheap. You can get a great pair of socks for like $10. Start with the lower strength, like 10 millimeters of mercury. And then if you feel you need more, work your way up. But in my opinion, when people get the medical grade ones, they never wear them because they're so hard to put on. But the standard athletic ones that are like 10 millimeters of mercury, people are much more likely to wear. That will help with venous flow because your veins won't engorge as much. Number 2, everybody works from home now, especially in the era of COVID. Get yourself some leg compression pumps. So what these do is they're on a pump and they go around your legs, and when you're sitting, every couple seconds, they pump and they push the blood flow. So it stimulates you walking and it's stimulating the blood flow. Personally, when I use these, not only does it prevent blood clots, but it makes you have less headache, you're less tired. I talk to people who, because I give these to people all the time, and what happens is people who sit at their desk all day tell me they feel sick, but with these leg pumps, they say they have more energy, they feel a lot better, their brain's working a lot better because your blood's cycling a whole lot more. Is there studies that prove this? Not that I know of personally, but this makes a big difference. And hopefully, even if you get a benefit out of that, this is a huge benefit for me. I wear those leg pumps when I'm on the computer for a long period of time, and I feel a million times better. And then the keys, same thing for arterial sclerosis. Get healthy, stop smoking, cure your diabetes, start exercising, start losing weight, stop drinking alcohol, take great care of yourself. If you're sitting in a car or a plane for long periods of time, compression stockings, pumps, start doing exercises every 20, 30 minutes, pump up your legs up and down, stretch your calf muscle, lift your legs, flex your thighs. If you can't wear leg pumps, because that's kind of the standard now in the hospital. You should be wearing leg pumps if you're in a hospital because the risk is very high. Not only in the hospital do they give you those leg pumps, but they put you on blood thinners as a precaution because the risk can be so high. So if you have a DVT or arterial sclerosis and you're in Michigan, come see us. We'd love to take care of you. But otherwise, go see your local podiatrist or primary care doctor. If that helped at all, please give us a thumbs like, give us a comment, tell us if we suck or if we did a great job, and give us ideas on future videos. Let us help.